About systematic reviews, the definition of systematic reviews is kind of a structured, comprehensive synthesis of the published reports and research studies that addresses a specific research and or clinical question using rigorous methods to minimize bias. Key characteristics for systematic reviews. I just prepared a list here. Well, obviously, it doesn't include all the points that we want to mention about systematic reviews, but it includes a bunch of points that are important for systematic reviews. To my understanding, the most important part of any systematic reviews or any article that needs to have an expert opinion is to have an expert in the team. So building a team that includes a number of experts on the field could help the authors and obviously the readers later for the systematic reviews. Specific research question is a very important part of any scientific paper, including systematic reviews. Comprehensive search, obviously needed for a comprehensive systematic review that can include or should include all or almost all the important data available in the literature. Explicit, transparent, and reproducible methodology. Outline based on the aims of the study. So to talk about this point, one of the most important parts to help the team write a very consistent and informative systematic review is to have it outlined and to let the authors, let the team know what to write in each section of the study. We will talk more in depth as we move forward through this talk, but outline is one of the most important parts of any systematic reviews. Critical appraisal, as we will talk through this PowerPoint, we will see how to review papers, how to look at the literature, and how to include and exclude the literature in a systematic review study. Minimizing bias, an inevitable part of any study, any research is bias, and how to minimize them is something that we are going to talk in brief in this presentation. Synthesis of findings and preparing a conclusion, which is the last and one of the most important parts of any systematic review. In orthopedic surgery in specific, why systematic reviews are very important. These are some of the points that came to my mind, and obviously there are more points that each of you have in mind and can explain and discuss. Obviously, systematic reviews provide a comprehensive reference on a specific topic for orthopedic experts. It can be scientists, surgeons, any provider, and this facilitates access to those data and results. This consolidates conflicting evidence. Sometimes there are different reports on different surgical techniques, different management methods, different diagnostic tools, that through a systematic review, one can know which one is better, which one is worse, based on the currently published evidence. Obviously, this doesn't mean that this is the final verdict and no one can contradict that, but systematic reviews provide a good database of what we already have in the literature. Systematic reviews support clinical guidelines and surgical decision-making. These reviews, these kind of articles identify gaps in current knowledge and helps in plans for future research and future clinical questions that need to be answered. As this step one, we need to define a research question and develop a protocol. The question sets the scope, search terms, inclusion, exclusion criteria, and data synthesis framework. In orthopedic surgery in specific, some questions will lead to a vague or overly large published information. If we bump into such questions, if we want to choose these questions for our systematic reviews, this might lead to disorganized and low impact paper. So this is something to avoid, and we will talk about it as we move forward. To define a good research question, one must pay attention to the following, and it is known as PICO framework: population, intervention, comparison, and outcomes. Population, who is the patient or the population we are going to focus on? We will use some examples to show that better. Intervention, are we comparing two surgical methods? Are we comparing two diagnostic tools or more than two? By two, I don't mean we necessarily need to choose two, but what is the intervention or interventions being considered for that review? Comparison, what are we comparing that intervention or those interventions with? What are the alternatives? And outcomes, what outcomes will you assess? What do you want to send out as the take-home message for your systematic review? So a good PICO question means should be specific, it should be clinically relevant, feasible, and original. Specific meaning it should be narrow enough to focus your search. So you don't bump into thousands of papers and a huge size literature to review. Clinically relevant, it means it should address the question faced in real life orthopedic decision making. And it's not just specifically for orthopedics, for any subspecialty, any specialty you should consider these criteria. Feasible. There should be enough studies in the literature to answer the question. So if on a topic you find a couple of papers, definitely it cannot turn into a systematic review or even a narrative review or short review. Original. We will talk about Prospero. We should make sure what we are doing is not a duplication of the previous work. At least in the past few years, no one has done it. Sometimes you see people like do a review after 10 years to see what are the updates. But if someone has done a review 2 years ago, the same as what we did here, it's a duplication. So better to avoid that. Some orthopedic specific tips. We should always consider including classification systems. For example, when you're having talus fractures, it's better to mention the type of the fracture versus just mentioning talus fractures, because as you might know, this affects the outcome. So we have to be specific as possible. We should always be mindful of surgical technique heterogeneity. So, for example, sometimes like you are comparing MIS or minimally invasive surgery with open surgery. So is it within our scope? Should we compare them, or this is something that add bias to our study? Functional outcomes. It's not very consistent among different literature, different reports, how people report the outcomes, specifically patient-reported outcomes. You might know about PROMIS or patient-reported outcome measurement systems. Different forms, different formats are being used, being reported, and comparing different forms together in one bowl might not be very consistent, and it sometimes might be comparing apples and oranges. So we should be mindful of that as well. Decide whether you want clinical, lab, radiographic, functional, or complication-related outcomes, or you want all. You have to know what you're looking for. This will help you later when you're designing the data sheet, the Excel sheet that you want to give to your team to gather data. So that's something to be mindful of. Let's look at an example. This is one of our recent papers that was published, and it's a systematic review on identifying the risk factors for children who suffered physical abuse. The title, which is Identifying Risk Factors for Children Who Suffer Physical Abuse, let's look at it based on the PICO criteria. Population, we are looking at children who suffered physical abuse. Exposure or interest, we are looking at the exposure to specific risk factors like individual, familial, community, societal. These are the risk factors that we are looking at among the published papers and reports to see if we can find any relevant outcomes. Comparator, children without abuse. So we are looking at the difference. We are looking at the papers who compared those who were referred to clinics with and without the signs of physical abuse. An outcome, We are looking at the documented physical abuse cases, including diagnosis or any case that were reported by the authorities. So what is the question here now, based on the PICO criteria we just reviewed together? The question, like if we want to frame it as a question, it will be something like this. Among children exposed to possible risk factors, for example, family environment, socioeconomic status, which factors are associated with a higher likelihood of documented physical abuse compared to children without those exposures? Why this question works, to my understanding, and everyone can criticize this, but this is how we approach the topic. First, the question is specific. We are focusing on children with documented physical abuse, not all injuries or maltreatment types. Clinically relevant. Well, the outcome of this study, to our understanding, could help orthopedic surgeons and pediatricians identify risk factors when encountering suspicious injuries in children. Feasible. Obviously, a substantial number of observational studies with these risk factors were there, and we found a good number of them, as we will review. And it's transparent. So authors registered the protocol and followed PRISMA guidelines to prepare this report. So as we're talking about the first step, which is defining a research question and developing a protocol, in terms of the protocol, there is a good guideline called Prospero. This will help authors avoid duplication and ensure transparency. Prospero includes objectives and aims of the study, eligibility criteria, including inclusion and exclusion criteria, search strategy, which we will talk about, outcomes of interest, and data extraction and analysis plan. There is a tip that might be useful for orthopedic researchers. We should always be specific. Again, I repeated it several times in this talk, but I'm going to say it again because there is a lot of bias in orthopedic reports and we should be mindful of them. So we should always be specific with injury classification, implants, and surgical techniques. There are a lot of biases in orthopedic practice among surgeons in different institutions regarding these and many other factors. So I provided a screenshot of Prospero webpage. Authors can log in, include their study there, and Prospero will help them to avoid duplication and ensure transparency. Search strategy. I have another lecture on search strategy. Obviously, you're more than welcome to refer to that. I'm going to just go over a number of important points for search strategy, including the databases. I'm sure most of you are aware of PubMed and Medline. That's one of the best medical databases that the authors can use. Other than that, Embase, Cochrane, Scopus, and Web of Science. I personally sometimes, or many times, in review articles, use Google Scholar. It's not very, I should say, expert-based or something like PubMed that you can use mesh terms and a lot of keywords and have an advanced search. It doesn't have that advanced search, but sometimes there are papers that are not indexed in some of these databases. It is based on the author's decisions to include those papers or not, but you should be clear in your search strategy if you have used Google Scholar or not. Sometimes when the number of papers or publications on a topic is low, the authors might also try Google Scholar. I personally like it and I use it a lot, but it depends on the search strategy and how the authors want to approach the topic. The search strategy, it's better to use mesh terms. I have talked about it in that talk, and it's easy to learn and easy to use. And the operators like and, or, not could be very much useful. And I have an example here for ACL injury. And also consider great literature, conference abstracts, and dissertation. This is where the Google Scholar thing also comes to your help to find these things, because some of them are not indexed in the other databases. An example here, like we have ACL reconstruction, which is based on mesh. The term is anterior cruciate ligament reconstruction, but we also use ACL surgery or ACL reconstruction not to miss any other publication. Sometimes the authors don't use mesh for their keywords, so we have to be as inclusive as possible to not to miss anything. And also we are looking at return to sport or failure rate. So in the second part of our search, we are including them with an or in between. And I mentioned here, you can definitely refer to the other lecture I have on search strategy. I hope it's useful. It's a good complement to this one. For step 2, literature review and study selection. This screening process is very important, and the authors should pay a lot of attention to this part because this is where a lot of bias happens in terms of gathering the papers we want to include in this study and also extracting the data. We should make clear exclusion and inclusion criteria. We should make sure all the reviewers understand what are these criteria and what to consider while they're screening the papers. Title and abstract screening is the first phase, and after abstract screening, we will go for full text review. On the right side of my page, you see the Prisma flow diagram, which is an example. I will give you a real example as we move forward. But this diagram will also help the readers of your paper know how many papers you found in your search, how many you included, how many you screened, how many you excluded, and how many you included in your final review and data extraction. It's better to have 2 independent reviewers for this process and a third one in case there was any discrepancies. And this is one of the examples of a recent publication that we use the Prisma flow diagram to show how many papers were reviewed and how many were included in our study. There are some suggestions in this process, which I personally enjoy a lot when I use them. Before, like maybe about 5-6 years ago, we had no access to such platforms, and we used to use the conventional methods using Excel sheets or other formats of data organization methods and do our systematic reviews, which was very painful. But these days, with online softwares, including Rayon, Covidence, RevMan, and other softwares that I might not have included here, but these are the most famous ones. And also with the citation management programs, such as EndNote, Zotero, and sometimes I'm not very comfortable with it, but word citations can work too. All these softwares help researchers do the process and take care of the whole critical appraisal, review, and even data synthesis and data analysis faster, better, easier. I personally use Rayon and Covidence a lot. My team uses both of them a lot, and they are most of their features are free. You can use them by just signing up and logging into their websites. And this can also help the authors have a platform online. So the reviewers can go through these platforms, review, rate, and extract the most important data, and is even like import the papers directly to these platforms and export the outcomes to their Word file or wherever they're preparing their manuscript. So this makes the whole process much easier compared to the conventional methods we used to have before. And in terms of citation management programs, Zotero and EndNote are both great. Zotero is free. Both of them are easy to use. You can extract and import papers directly from the websites or by the features these softwares have into their library and then cite them within your manuscript, within your draft, which makes the process much easier, mainly because you might need to cite a large number of papers and then order them and organize them. And these softwares help you a lot with the process. Step 3, data extraction, debiasing, and data synthesis. For data extraction, The first point that I wanted to talk about here was the need to create an standardized data extraction sheet based on your aims and questions. In this sheet, you should include the author. Usually people include the first author's name, the year of publication, and the journal. The design of the study, it is very important to have the design of the study. As you know, the value of each of these studies is different. RCT has a very high value compared to the other types of studies, mainly the retrospective studies. So it will help later to assess the quality of these papers. Population size and population characteristics are also two other important criteria, mainly when you are discussing these outcomes. Because just imagine you have a study that has, let's say, 100 participants versus a study that has 2,000 participants. And the outcomes of these two studies are not consistent with each other. So which one will you choose? Obviously, the one that has a larger population and probably has a better and more consistent methodology. You should extract the interventions and the comparison outcomes, whatever you have in mind based on your questions. And these should be in your data extraction sheet. The outcomes, other than the intervention and the comparators, for example, like you're looking at radiology outcomes, lab outcomes, clinical examination, patient-reported outcomes, or whatever the question says or the aims of your study needs, you have to be able to extract from these papers. And follow-up duration is an inseparable part of many orthopedic studies. To organize data, as we talked before, you can use Excel or online softwares like Rayon, Covidence, or RevMan, and all these can help. Again, personally, these days I'm using the online softwares, and I'm very comfortable with them. Risk of bias. How to assess that? Risk of bias assessment is a critical methodological step in any systematic review. It serves multiple important purposes that strengthen both the validity and interpretability of the results, and it influences study weighting and supports transparency. It might not be needed in all the types of reviews. As you might know, we have different types of reviews, but for systematic reviews, especially those that end up with meta-analysis, ROB, or risk of bias, is a very critical step to do. And overall, personally, when I review systematic reviews, when I review these papers, I do want to see if the authors really assess for bias. There are different validated tools to look at the BO ROB, or risk of bias. One is the Cochrane risk of bias tool, and you can find it online. Observational studies, you can use NOS or Newcastle Ottawa scale. These two methods are the validated tools that people use for the bias assessment. There are different forms of looking at the possibility of any bias in the reports and studies you're including. You have to mention that how you assess for bias, and if you did not really de-bias, or if the studies were kind of biased based on your expert judgment, you should mention when you're discussing those studies. It should be reported in your methodology. It can be reported as a bar chart or something like that, like a summary of the biases of the study, or we have something called traffic light table. And that can also be used to report the risk of bias assessment outcomes. Not every paper has that, but this is a very valuable outcome or assessment that you can do when you're running a systematic review. And it will help you a lot when you're interpreting your findings. When you're interpreting your findings in light of risk of bias and discuss how these biases could affect your outcomes, the readers would trust your outcomes much more than someone who has not really assessed the included papers for any types of biases. In orthopedics, You should be critical of selection bias specifically and loss to follow up. These are two of the most common biases in orthopedic studies. As another tip, it is always good to use two reviewers for risk of bias assessment. And if there was any disagreement, there could be a third reviewer to resolve that. Data synthesis. Usually for review studies, qualitative synthesis is very common. And authors usually summarize the findings of the included studies, especially when the outcomes are kind of heterogeneous. In case the authors are aiming for meta-analysis, then they might consider quantitative synthesis, for which you might use RevMan or R. I'm personally using R. I'm more familiar with it, but there are easier ways. Again, RevMan makes it much easier. It's good to do an analysis on the effect sizes, for example, the odds ratio, relative risk. It's good to assess the heterogeneity using I-square and sparse plots for visual displays. One of the things that the author should always consider is, again, as I mentioned, for most of the reviews, including narrative reviews, scoping reviews, rapid reviews, and even umbrella reviews, qualitative synthesis is enough. Usually reviewers will be happy with it. However, the quantitative synthesis and as we will talk about, the grade of the evidence will add a lot of value to the review paper that you're sending out. Regarding the grade and how to grade the evidence, we should use the grade approach to rate the overall evidence quality. It is basically an expert part, or a part that should be done by an expert. So experts should assess the literature and grade them using high, moderate, low, or very low quality. And these gradings are based on the risk of bias, consistency, directness, precision, and publication bias. There are different tools for grading. You can use GradePro, which is a website. It is free, I think, for 2 or 3 authors if you want to use it. We also have Cochrane Handbook. There is a chapter on how to grade evidence. And we have Prisma 2020 that recommends including grading systematic reviews, and there are some methods for it. I personally use GradePro, sometimes Cochrane Handbook, but it really depends on how the authors want to approach it. In many of my systematic reviews, I haven't used grading because sometimes it's a bit hard to do it, and sometimes there are inconsistencies. But if you have an expert in your team, I highly suggest grading the evidence. There are different reasons to downgrade or upgrade the evidence quality, as you might guess. The reasons that might downgrade the quality of an evidence is obviously bias, inconsistency, indirectness, and imprecision, and also publication bias. Those that upgrade the quality include large effect size, dose response gradient, and the fact that the authors have included and suggested the confounding factors in their study and included them in their analysis to reduce the bias. Step 4, the best part for most of the researchers thinking that they are done and now they are good to go and write the manuscript. But if you ask me, this is the most important part. And well, maybe it's exaggerating saying most important part, but one of the most important parts, at least for me when I review, I do like to have a very structured manuscript that sends out the message very well, very clear, and elaborates what we were aiming for. So the most important part to write a good and structured manuscript is to develop an outline. The outline is better to be provided and created by an expert who knows how the story has to be told. As I keep telling all the researchers and all those who I had the privilege to work with, it is good to tell a story. It's not good to write a manuscript like a nerd who just wants to put a bunch of lines together and send out some scientific message without the reader understanding where did it start and where it is going to end. So outline should be focused on telling a story, starting from a question, aims, structure, methods, results, a good discussion, and a good conclusion. The structure of systematic reviews are almost similar to any other scientific paper, from abstracts to conclusion and references. There are different points to be considered in each of these parts. For me personally, one of the most important parts that I pay a lot of attention and needs to be very accurate, clear, uh, are methods and results. So search strategy should be clear. The selection criteria for the included studies should be very clear and reproducible. Bias assessment, any methods you use, it has to be there. And it has to be a table or anything that shows how you assess the bias and how you are considering the value or effect of each of the papers you included in your study versus others. Results. Please, Prisma flowchart is one of the most important parts as we talked about. The characteristics of the populations. Usually I use a table to include all the factors that we extracted from each paper and their findings. And as we talked about, the authors, year of publication, etc. So it makes it much easier, not only for analysis, but also for presenting the results and discussion later. And one of the most important parts that authors should consider when they're preparing the results section is to prepare graphs and charts with appropriate captions and explanations. One sentence that I keep telling my colleagues and my trainees is that make sure when you're preparing a chart, a graph, a figure, a table, if a reader reads or looks at your table or graph or figure without even looking at the content of your manuscript, understands that figure, that table. So the caption is very important. Discussion. Interpretation of the results is the main part of the discussion. How it should be structured should be discussed beforehand, preferably by the experts in the field. What each paragraph should be allocated and assigned to, what topic each paragraph should talk about, should be outlined. The limitations of the study and the implications and clinical applications should be mentioned, and the conclusion should be the take-home message. We should avoid some common mistakes, and we all have seen this in the literature, even those that are peer-reviewed and published. Vague research question is a killer. Incomplete search strategy in a way that the others cannot reproduce what you have already done, ignoring to register the protocol, including studies of poor quality. Sometimes when the number of studies that are found is small, some authors might be tempted to include some poor quality studies, which will affect the whole study, and that should be avoided. Over interpretation. Sometimes some conclusions are too bold, and an unwritten rule in research is nothing is 100%. So using terms that do not show that what you got out of your study is a fact, is a bold statement, is something that no one can deny, is something that no one can prove wrong, is usually wrong. So try not to overinterpret. Try to say what you have seen, not more, not less, and make sure you always include the Prisma chart and the details of the included papers, articles, figures, and others in your study. Some special considerations for orthopedic researchers. As we talked about, heterogeneity in surgical techniques and implants is a part of orthopedic research. So authors should always consider them when interpreting the outcomes. Variation in surgeons' experiences. In other words, like a surgeon with a few years of experience might have different outcomes compared to a very experienced surgeon. Building on that, even institutions, the outcomes in one institution might differ from another. As you see on my last point, diversity and the effect of social determinants of health might affect the outcome. And we should always be considerate those facts. And long-term follow-up issues, there is an unwritten rule again saying studies with less than 2 years, and some experts say less than 5 years follow-up, might not be very valuable. Well, obviously, this is something that we have to consider in the context of each topic and each study. Sometimes a study with 6 months follow-up might be sufficient, but usually the longer the follow-ups, the better and the less biased. And we should also have in mind reporting the outcomes of studies like radiologic union, functional outcome. These are some of the outcomes that might change in terms of how they are being reported from expert to expert, from institution to institution. And there could be bias regarding these outcomes. And we should also mention that, and we should also be considerate of those. One of the hottest topics these days in overall orthopedic research or medical research, but here specifically about systematic reviews or review papers, is whether we can use AI or not, and what are the applications of AI tools like ChatGPT, Perplexity, Cite AI, Research Rabbit, Elicit, Cloud, and other platforms. How can we use them? Because I'm sure most of you have experienced that. This is so annoying how people these days use AI to prepare a simple email or a simple text, and the context and the method AI writes these things is now kind of familiar to our eyes. And sometimes some readers find it inappropriate for any reason. However, this doesn't mean that we should not benefit from these advanced tools. And I'm just going to share some of my own experiences with this, because I personally don't like AI to write my manuscripts, but I do get a lot of help from it, and I will tell you how. So there are different platforms like ChatGPT, Cloud, Perplexity, Elicit, Research Rabbit, Cite AI, and Consensus. Each of them have different uses, different applications, and sometimes they overlap. Most of these, like Perplexity or ChatGPT or Cloud, they overlap. Cite AI is built for something similar, but a bit more specific for research, but the performance might not be as good as some others. But I use these platforms for organizing my data, for helping me refining my PICO questions, to help me. Sometimes even I ask these platforms to summarize my papers. Like sometimes you're driving, you're walking, you can upload a paper, or you don't have time, you can upload a paper onto these platforms and ask for a summary. And it will help you with the screening process. It will help you with extracting the main points. It will help you with organization of the outcomes. And sometimes it will also help you find new resources, because when you ask them and maybe your keywords or your methodology did not work, so maybe you can find more resources, which this one, you have to be a bit careful, because I will talk as we move forward. Sometimes AI hallucinates, and sometimes the information they share with you, these platforms share with you, are not accurate. And we will talk about it. However, you can also use these AI platforms to make your text smoother. help with grammar, help with how you can summarize a paragraph. Maybe your paragraph is like overworded and you want to summarize it. And again, you have to be careful to read it again when AI helps you revise it, because sometimes, again, there are some misinterpretations, misunderstandings, and AI might not give you an accurate summary of what you want. I'm not saying not to trust it, but I'm saying be cautious about possible flaws and make sure before sending the outcome, sending your manuscript, sending your draft out, all the authors, mainly the senior and the lead author, who are the most responsible people for the study, read it again and again and make sure there is no false data, there is no wrong data, there is no mistake. So there are, as we talked, some advantages of these AI platforms: faster screening and abstract summarization, assist with grammar smoothness, writing clarity, and organizing the text. It can also, or these platforms can also help you with drafting summary of the papers, prioritization of the papers, even for full text review. And there are some caveats to this as well. As we talked, always verify the references. So hallucinations are possible. It cannot replace your methodology. It cannot replace your writing. So look at it as a complement, not as a replacement. Should not be used, these AI tools should not be used for final data extraction or bias assessment. Always read the text after editing by AI. I'm repeating this again because I was harmed by it. So don't let it go without reading again. And try to explain what is exactly needed in your prompt. Learning how to prompt, how to write your prompts for these AI platforms is a very important part of how to navigate through this process.